Okay, good afternoon, everybody. My name's Dean Sullivan, Chief Strategy Officer. Delighted to be here today, launching the HSE Climate Strategy. We have a few very interesting speakers today, including our own Chief Executive, Bernard Gloucester. Just a few introductory remarks from me, and then I'll hand over to Bernard. So hopefully we're all aware by now, it's pretty warm in here today, but the climate emergency is one of the single biggest challenges facing us as a health service, as a nation indeed, worldwide. The government in Ireland has set a range of greenhouse gas emission targets that all public sector bodies in Ireland are obligated to meet, and these include achieving net zero by 2050, and on the way to that, reducing emissions by 51% by 2030. Peter Smith and his estate's colleagues are already taking steps to improve the energy efficiency of our buildings and ensuring that our future buildings are appropriately designed from a net zero perspective. Building on this work, the HSE have recently completed a wider climate action strategy which encompasses not only how we design and operate our buildings, but also other key issues, including, firstly, the sort of goods and services we procure, our future transport fleet, how we minimise travel for patients and staff and encourage more sustainable forms of travel, how we develop greener spaces for patients and staff to enjoy, and so on. It is this strategy which I'm delighted to be launching today, following its consideration by the board of the HSE earlier in the year. To support the launch, we'll firstly hear a few words from our Chief Executive, Bernard, and then Philip and the team will go in more detail around the particular challenges presented by climate and how we propose to respond to those within the HSE through the implementation of the strategy that I talked about. So without further ado, now I'll hand over to Bernard Gloucester. Thank you.
Thanks, Dean, and good afternoon, everybody. It's good to see so many people join a webinar. Some 150 almost people joined so far this afternoon to participate in what some might instinctively at first turn say is maybe not the core business of a health service provider, but nothing could be further from the truth. I'm delighted to be here to support the HSE Climate Action Strategy and this webinar to launch it. It was something I have to say I was very struck by when I came to the organisation, the work that had been done on this, which wasn't perhaps visible to too many. There was very I think not just enthusiastic, but very positive welcome from the board when this was discussed at the board, and indeed it was amazing the conversation that it generated. And so why would we have a climate action strategy for the HSE? Well, there are perhaps so many dimensions to that, and some much more expert than I will guide you through that in some of the comments this afternoon and in the team that Dean has introduced to this. But I think there are a couple of things that are just particularly striking. Firstly, we're a public sector body and therefore we're part of government strategy. But we're also a leading public sector body. We're the largest employer in the state. Over 150,000 people work in the HSE or the HSE Section 38 agencies, and that's before we get to all of the funded partners in the Section 39 agencies. So we are a huge community of people, and that of itself suggests the difference we can choose to make, or the difference that perhaps we forego the opportunity for just as a community of people. And that strikes me as particularly strong. Then there is that, I suppose, limited association between climate strategy and just buildings. And as Dean said, we do so much more as a health service and as a health service operator and provider. Firstly, in the enablers to some of our work in procurement, in the goods that we buy, the amount of people we have on the move at any one time in terms of transport and what that means for everybody. And we have a whole series then of waste management responsibilities and so on. And then we come into the actual delivery of healthcare itself. And in the actual delivery of healthcare, I was certainly struck to read the amount of things that we do that if we do differently, how we would make our substantial contribution. And then, of course, there is the core business that we're in, and the core business being the health of our population, the health of our people, the health of our fellow citizens, the health of the communities that we live in, and the impact of climate anomalies and direct climate impact, and what that does and means for health in so many different ways, in respiratory disease, gastrointestinal diseases, transmitted diseases, heat stroke, mental health, just everything that's connected with climate change, climate strategy, or the absence of climate strategy has so much a direct bearing on health. We often talked in the past about the determinants of health, the standard and very important ones like education, socioeconomic status, housing, and so on. And now there is no doubt that a major determinant of health is in the climate and the climate crisis space to which the world seeks to respond. I can remember not too long ago in the public service, we would have been talking perhaps about climate in the context of the generations to come. And there is no doubt we're now forced to talk about climate and climate response in terms of the generation that we are today, let alone the generations to come after us. So there is an enormous challenge. It's not one on which we can automatically switch to an immediate level of perfection, and to use that phrase, perfection being the enemy of the good. But we can certainly make a substantial body of continuous improvement. We have many old buildings. We can make improvements in how we retrofit and use those. We don't have to dispense with everything. But perhaps most in our own ways of working, we can make the biggest difference. So I'm delighted to welcome this climate action strategy as part of the overall HSE future proofing and current day improvements. And the rest of this briefing on the strategy, I think, will give some very significant insights as to just why this is our core business. Thank you.
Philip Crowley is my name. I'm the National Director of Strategy and Research in the HSE. I'd really like to thank our CEO for his support, which has been strong and constant, and it's support we'll be drawing on as we go into the next months and years of implementing this really, really critical strategy. So the climate crisis is a health crisis, simple as that. It affects our health in so many different ways. We've come through a decade. The last decade is the hottest decade ever recorded. Every decade in the last number of decades, our environmental temperature has gone up by 0.2 degrees centigrade, and we are already in a climate crisis. So the time to act is clearly now, and we're building on a lot of work that's already been done and has been alluded to already, and we'll hear more about very shortly. But this climate crisis is affecting our health in so many different ways. It can affect our health through heat-related disease, through skin cancers, malignant melanomas. It can affect our respiratory systems, chronic obstructive airways disease, and cancers even through particulate matter in the atmosphere. It can affect us through flood and the disruption that floods create for our health service. And it can affect us through different patterns of foodborne disease as a result of the changes in climate. So this is upon us now, and this is why we have this strategy, and this is why we have to act now. So not only does the climate affect our health, but our health services affect the climate. It's a two-way street, if you like. The estimates generally around Europe would suggest that about 5% of global emissions come from healthcare. So we are players in this, in that we are contributing to the crisis. And what we are now doing is committing to reducing that impact in a whole series of different ways. And there are a number of examples there on the slide of different correlations that you can see between, for example, an anesthetic gas that we use frequently called desflurane. It is an extremely toxic gas in the environment, and it is a gas that I think we can probably do without, and we will be working to eradicate it from our anesthetic delivery systems. Inhalers used by children with asthma, for example, and adults, they also are significant contributors to climate change as well. And again, we'll be working with our clinical colleagues to act on that. But why are we such a big contributor to climate change? We have obviously high energy intensive buildings, with a lot of very intensive activity in them. We have a sizable transportation footprint, both from our staff and from our customers, if you like, our service users. Our supply chain is a significant contributor to our overall impact on the environment, and we'll be working on that in partnership with our suppliers to ensure that that impact is also reduced. We use a lot of single-use goods, and increasingly so over the last decade. And again, that's something that we can probably do without and do better with. And we've I think, in truth, when we talk about our plans and our strategies, we have a kind of a limited consideration of the impact of our decisions on the environment. And I think that is definitely going to change from here on in. So the HSE, as Bernard has said, is a key player in our society. It's a very, very large organisation, very large environmental footprint, a huge workforce who I think will join us in this quest that we have to reduce our impact on the environment. And I very much look forward to working closely with our staff over the coming years to ensure that we really, really do green up our health service. So the strategy builds on and commits to the targets set out in the government's climate action plan. That in turn arose out of a response to the Climate Action and Low Carbon Development Act amendment in 2021. And as has been said, by 2030, we will be reducing our greenhouse gas emissions by 51%. We've made that commitment. We'll be improving our energy efficiency by 50% by 2030. We have a whole series of green teams and people working on this around the system, and I hope that we will be able to support and enable them to really have the impact that we need to have in order to ensure that we become the greenest health service we possibly can be. So thank you very much for listening to me today, and I'd like to hand over to Roisin Breen, who's been a key mover in all of this work so far. Thank you, Roisin.
Thanks, Philip.
That just moves on.
So the HSE Climate Strategy Overview, I'm just going to give a very brief overview of the strategy. So the strategy was developed in a consultative manner with a wide range of key stakeholders over a 6-month period. We also reviewed international evidence on health and the environment. As Philip talked about earlier, we linked it in with the Government Climate Action Plan. It is a multi-year programme, updated and reviewed against any emerging legislation, WHO recommendations, national policy, and will be updated in line with the Department of Health Climate Adaptation Plan. The key strategic goals within the strategy build on existing work already happening within HSE Capital and Estates Climate Action and Sustainability Office, and indeed the many green teams dotted around the country. It also builds on work of areas such as health and well-being, global health, and many examples of local leadership and action. It responds to and outlines lots of things within it, and we have a clear outline of where we want to cut our emissions and create a greener health service. In doing so, we hope to help protect and prepare a population from health consequences of climate change. It will be a multi-year programme and updated and reviewed against all emerging legislation. So it will lead to more granular targets and timelines being defined in time. It will be reported on a regular basis to the HSE board, and will the key metrics that we have will ensure we are monitoring improvement as we go along. So this strategy aims to drive the necessary transformation by committing to this vision. So the HSE is committed to achieving net zero emissions no later than 2050, delivering healthcare which is environmentally and socially sustainable. In order to achieve our strategy, we have 6 priority areas of focus. The first being sustainable buildings and the green environment. The second, transport and mobility. The third, sustainable procurement. The fourth, greener models of healthcare. Number 5, water and waste management. And 6, adaptation and resilience. Across these 6 priority areas of focus, we have developed 10 strategic objectives to help us to deliver on the strategy this year. So this year we'll be hoping to do baselining exercises and developing guidance to 1, reduce our energy-related greenhouse gas emissions across our services. 2, better utilise and promote our fabulous green spaces. 3, decarbonise our fleet inclusive of emergency vehicles. 4, promote low carbon and active travel initiatives for both our service users and staff. 5, align purchasing decisions with our decarbonisation and sustainability goals. 6, baseline our supply chain emissions so we can get a measure of Scope 3. 7, develop greener models of healthcare delivery. 8, reduce and manage waste. And 9, conserve and reduce water usage across our services. And lastly, we hope to protect and promote the health and welfare of the public, and this will be done in consultation with our partners in the Department of Health. In order to deliver on these 10 objectives, we have 2 enabling support functions. Firstly being communications and training, which will supply expertise in this area across the 10 objectives. And secondly, we'll have a measurement and assurance group, which will measure and report on regular intervals on improvements achieved. Our journey to become a more sustainable healthcare provider is well underway. We are hoping now to give you some examples of initiatives that are happening around the country. So in terms of greener models of healthcare, Philip has already alluded to anaesthetic gases, and they are a huge problem. We've been working with the College of Anaesthetists, and I'm going to highlight some of the examples here. So for example, in the National University of Ireland, there was a review done of nitrous oxide piping leaks, which led to a massive reduction, 80% in CO2 equivalent from nitrous oxide. We hope to build on this year. And at a national level, 20% of anaesthetic departments that use Desflurane in 2019 have ceased its use completely. Again, we hope to roll that out nationally. As part of the HSE Capital and Estates Green Healthcare Programme, there has been many improvement practices to do with waste and water and clinical waste. So you can find these on greenhealthcare.ie. Many examples exist. For example, Midlands Tullamore Hospital carried out a project where they reduced clinical waste by 0.5 kg with a 26,000 per annum saving, which is fantastic. So we're hoping that we can build on these initiatives. I'm now going to hand over to Peter Smith, Assistant National Director in Capital and Estates, who's going to tell us a little bit about the work that's happening in their area. Thank you.
Thanks, Roisin. If we can just move on to the next slide, please. I'm going to talk about the work we've been doing in Capital and Estates in this area. International advice for dealing with emissions reductions programs in organisations such as our own is to start with energy in buildings, right? Then that's oil use, gas use, electricity use, and really all emissions associated with the operation of our buildings. The logic of that is that these emissions are in our direct control. They form a large part or a large portion of the overall ask. In our case, it's around about energy-related emissions account for about 37% of our overall health emissions in Ireland. So that's what we've done. That's the approach we've taken. We're fully aligned. This approach is fully aligned with the Irish government approach, which is deal with energy first. The energy or the targets set out in the Climate Action Plan currently are energy-related targets. So we're part of Ireland's journey towards net zero by 2050. We started in 2018, so we're 5 years into our journey. We've established our Capital and Estates Climate Action and Sustainability Office, which incorporated the National Health Sustainability Office, which was in place before that. And we've established, crucially and critically, a key partnership agreement and arrangement with the Sustainable Energy Authority of Ireland. We've put a lot of programs in place, and we've made a lot of progress through the work of a great team that we have in place, led by my estate managers, Helen Marr, Kevin Sheridan, Vincent Brennan, and our office manager, Catherine Buckley. I'm going to hand over to Helen in just a second to go through some of those works, but the one point I'd like to make before I hand over to Helen is that it's not easy to get a program with the scale of the program we put in place up and running, but it is possible with commitment and cooperation of everybody, and everybody making a decision to get involved in making a change. So I would like to, really say that when people get involved and make a commitment, we can actually affect change. So I'm going to hand over to Helen to bring you through some of the more detailed actions that we've progressed.
Thank you, Peter. So my name is Helen Maher. I work in HSE Estates along with Kevin Sheridan and Vincent Brennan, and we lead out on the team looking after the rollout of the HSE decarbonisation infrastructure programme across the entire building stock of the HSE. So we've been working in this area for at least 10 years, and in that process we have targeted our efforts on the 170 significant energy users across the HSE, and these would be our largest buildings, largest offices, all our HQ offices, every building, and community healthcare buildings down to about 100-bed locations. And that's where 80% of our energy use across the HSE is actually being generated. So we have targeted our resources in that direction. We have set up pre-COVID and post-COVID, we have 112 local energy efficiency teams set up in healthcare locations across the country. Our target is to have 140 energy teams across the country by the end of this year. So if there's anyone in any location that hasn't got an energy efficiency team and would be interested in setting one up as a significant energy user, we would love to hear from you. Those teams are supported by our energy officers in 3 regional energy bureaus across the country. And what we do is provide the technical support and the assistance and access to the funding that is required in order to make changes in your healthcare building and how you provide your services. We have implemented a programme of 30 million euros in terms of shallow retrofit. So that would be things that we would have like lighting upgrades, window upgrades, that kind of thing in terms of our building over the last 4 years. And that sounds like a lot of money, but in construction terms and in terms of what we do in our buildings, you know, it doesn't fulfill our agenda. So we are going to have to increase our funding in that regard. But what we've done in the last 4 years has saved 7,000 tonnes of carbon dioxide equivalent for the HSE, which is, you know, like saving energy from and carbon from 700 homes per year in the Irish housing market. So this year, for example, we spent 16 million euro in terms of capital on our shallow energy programme. So anyone that's based in a healthcare building, significant energy user that would like to access that funding, please do get in touch with us. As regards our new buildings, we have an energy efficiency design programme and a towards zero carbon methodology programme that we have mandated for all HSE buildings, and that applies to all our new building stock. The buildings that we're designing and specifying today are going to be carbon zero when they are built now for 2050. We have Vincent is leading out on a 10 pilot Pathfinder programme. This is for our existing building stock. So we have buildings that date from the famine right up to this lovely building here at Dr. Stevens that would have historical value. And they're also very complex buildings to carry out works in. So we have 10 pilot Pathfinder projects in acute, CHO and office HQs across the HSE that we're using to really transform buildings. This is deep energy retrofit. This is leaving the buildings unrecognisable by the time they've been transformed for carbon zero. It's going beyond the shallow retrofit, the normal stuff that we do. This is decarbonising those buildings, taking them away from fossil fuels, taking them onto the renewable energy sector. So we're leading out on that, and that's going to inform how much funding and how much technology and new technology we're going to need in order to transform our healthcare buildings across our building stock. We also have a project that's leading on from the Green Healthcare Programme that Roisin spoke about, which is our online sustainability tool for community healthcare. So we recognise the contribution of all healthcare buildings across the HSE, not just the significant 170 energy users. We want to reach out to all HSE staff in all locations and use the online sustainability tools so they can generate their own site-specific action plan on how to make their building more sustainable, more energy efficient, use less water, create less waste. We've piloted that thanks to Tess O'Donovan and CHO4, and we're rolling that out now across the entire CHO4 with a view to moving towards the regional health areas. And that's how we're going to reach all our staff and change the culture across the HSE in terms of the carbon and in terms of climate action. So we've a lot done. We've good foundations that we have laid, as we'd say, in the Capital and Estates function, but we've a lot more to do. And for example, in our 2021 year, when we assessed our emissions for that year, we had achieved a 9% reduction. Now our targets for 2030 are a 51% reduction in greenhouse gas emissions. So we have to do an awful lot more. We have to increase everything we do fivefold. Just to give you an example of one building, so this is one building, just to illustrate what we're trying to do across the entire building stock of the HSE, St Mary's Hospital in the Phoenix Park, but the same would apply here to Dr. Stevens, where we are here today. We work with the green teams in those locations and we install solar panels on the roof in St Mary's Hospital, 300 to be precise. We generate electricity in that location. We're saving carbon on an annual basis in that location. It comes at an investment of €100,000. It's a 2.7-year payback, which is good for us. But our focus now is in regard to carbon. We're looking at reducing carbon. We're trying to take all HSE buildings away from their usual route of depending on fossil fuels and moving towards renewable heat. And this is an example of a deep retrofit of a HSE building. And you can see how we progressed from LED lighting, PV panels, and now we have that building is will be heat by a heat pump. So it's going to be completely heat on renewable heat, no fossil fuels involved in that project. And that's an example of what we're trying to do here across the entire HSE building stock, which extends to 2,400 buildings. In relation to the green environment, we've noticed that, particularly post-pandemic, there's been a lot of interest from our staff with regard to the green environment and valuing our green space in our HSE campuses. They're looking for, outdoor space, therapeutic space for our clients, our patients and our staff, who are living and working in very intense healthcare environments. A number of locations, particularly our green campus flags like Cork University Hospital, Sligo University Hospital and others have been involved in putting in biodiversity, wildflower, outdoor equipment for staff and for patients in order to make those spaces more therapeutic, used by staff. And it's something that has come as a post-pandemic and we're happy to support it. So that's it. Thank you.
Okay, everyone, that's nearly us at an end now. You may have heard the noise in the background there, which sounded suspiciously like someone chopping some trees down, which would be a bit ironic in the middle of the climate sort of launch, but there we go. But thanks for sorting that out. So just a few things to say and then we'll get wrapped up. So first of all, thanks to our speakers today, to Bernard, our Chief Executive, to Philip, Roisin, Helen and Peter, to EY who are here today as well, who provided professional support and input to the preparation of the strategy. And finally to Sheila, Fidelma and others who were instrumental in getting today's event organised as smoothly as it has been. So thanks to everyone there. Hopefully today's session has been helpful for you all in updating you as to what we have been doing as an organisation and now what we're intending to do to step that up and broaden the scope out to tackle climate issues. And in conclusion, I would just like to say thanks to you all for finding the time to join today with your busy schedules. I think I'd like you to leave with a thought that, the climate agenda, everyone has a role to play in tackling it as individuals, as teams and as an organisation as a whole. We must all show leadership in this key area. Thank you.